Fasting FAQ. Pro tip. Even when you are not fasting, hunger comes and goes, and it will sometimes during fasting as well. The best thing to do if you feel hunger pains is to drink a big glass of water and then brush your teeth. This little trick works wonders as the taste of toothpaste instantly shuts down the desire to eat. Bad breath or bad taste in your mouth. People sometimes report a metallic taste in their mouth when they start fasting. Others report that their breath smells like nail polish or fruit. This is a sign that your body has entered ketosis. Ketones are expelled through the urine and exhalation, and they may have an odor. For instance, acetone is one of the ingredients of nail polish. This odor and taste will go away over time, though you may need to brush your teeth more often in the first few weeks. What if I experience bloating? If you're bloated, you may have consumed too much salt and your body is retaining water because of it. Try reducing your salt intake. Coldness. If you feel cold while fasting, that's a sign your body is entering ketosis. Your body is simply having a bit of trouble moving from burning glucose to burning adequate fat to keep you warm. This is nothing to be concerned about. You should warm up once your body becomes fat adapted and fully makes the switch from burning from sugars to fat. Constipation. Fasting causes your insulin levels to drop, which sends a signal to your kidneys to release stored water. This can cause you to become dehydrated, then constipated. During the days that you are not fasting, increase the amount of leafy greens and fiber you consume. During your fast, soak in an Epsom salt bath and take magnesium citrate at a starting dose of about 400 milligrams once per day if you must. Hydrate with salt and water. Many people assume they're constipated during an extended fast when in fact they just don't have anything in their intestines. If you haven't had a bowel movement during a long fast but you aren't cramping, then you're fine. Diarrhea. If you experience diarrhea while fasting, try mixing 1 to 2 tablespoons of chai or psyllium husk with water. Wait 10 minutes and then drink the mixture. Chai and psyllium both absorb excess water in the digestive tract, allowing less liquid to be expelled with loose stools. Dizziness is often a sign of mild dehydration. Be sure you're drinking water throughout the day. Consume extra salt. Some people may be experiencing stabilization of their previously high blood pressure. If you're on blood pressure medication, have started fasting, and are experiencing dizziness, be sure to see your doctor. You may need to lower your medication dosage. Dry lips. This may sound counterintuitive, but dry lips are a sign you are drinking too much water and not enough salt. Add salt to your water. Fatigue. When you start fasting, you may feel tired as your body transitions from burning sugars to fat. This should pass within the first 3 to 4 fasts, and you will begin to feel more energetic. Headaches are very common when you're fasting for some people. We don't know exactly why they happen, but there is speculation that it may be due to salt deficiency. To prevent and treat headaches, try consuming more salt. Stay away from ibuprofen and other painkillers. Heartburn. If there's no food in your belly to absorb your stomach acid, some of it may come up, causing a tight burning sensation in your chest. Try an over-the-counter antacid. Intense emotions. Volatility and feeling an intense, often explosive emotions aren't incredibly common, but that may happen when you start fasting. It's a dramatically new lifestyle, and it's normal for your mind to feel a bit overwhelmed. Hang in there. Surround yourself with people who love and understand you, and seek professional therapy if needed. Some women may become more emotional or irritable only on extended fasts of 5 days or more, and only when they're new to fasting. These women may become more emotional because during an extended fast you start to lose belly fat in large quantities. Excess fat cells produce excess estrogen. The loss of those cells release the estrogen out of your storage and into the bloodstream. So, for a short period of time, your hormones soar, which has an impact on your emotions. People who lose the most water weight are the ones to report the biggest mood swings and irritability. This is due to the electrolyte loss that is experienced when there is a decrease in water weight. This is only a short-term problem, and the mood tends to stabilize when the body stops dumping excess water weight. Nausea. Feeling nauseous is not considered normal while you're fasting. It can be a sign of dehydration. Drink water, and if you are experiencing anything more than a short burst of nausea, or if nausea increases to a degree that makes you uncomfortable, stop fasting. Sleeplessness. Most people report having sleep issues during their first 2 weeks of intermittent fasting. This is the result of your body adapting to the increased level of adrenaline that produces while you fast. Create a calming, relaxing bedtime ritual to try and wind down. You might dim the lights, drink a warm cup of herbal tea, and curl up with a book until your body tells you it's ready for sleep. Avoid looking at screens, televisions, phones, laptops, and tablets before bed, as they emit a blue light that interferes with sleep. If the sleeplessness persists, try taking a melatonin supplement. Thirst. Increased thirst is completely normal while you're fasting because after your body burns the fuel in your stomach, it burns glycogen. Glycogen is bound with water molecules. Ever hear someone say that instead of losing fat, you've lost water weight? That's what they're referring to. If you feel thirsty while you're fasting, drink more water. Upset stomach. An upset stomach, as opposed to nausea, is likely the result of hunger pang, which can be alleviated by drinking mineral water. Can I fast trying to get pregnant? Yes. In fact, countless people who have struggled to get pregnant for years have used fasting to become so. Can I use a healthy sugar substitute like stevia? It has no calories. While stevia is a healthy sweetener and it doesn't spike our glycemic index, and it's true it doesn't have any calories, this is the old falsified paradigm about weight loss sneaking in again. Eat less, move more. It does cause a spike in insulin, and since we learned that weight loss is all about a hormone-insulin imbalance, we can't use healthy sugar substitutes because our bodies hormonally can't tell the difference and insulin levels will rise. How much weight will I lose when I fast? It depends on your BMR, but you can expect between 1/2 to 2 pounds a day. How should I break my fast? It's best to have some non-sugary, low-carb liquids. Try soup or vegetable juice. Your taste will have changed and you will get fuller faster. Consuming a lot of food may lead to stomach aches or nausea. Sweet foods may be too sweet now. It will almost seem that your stomach has shrunk, so honor how your body feels and get used to not eating as much as you did before. You will now enjoy a much closer connection to food and what it tells your body. What food should I eat when I'm not fasting? Too many changes at once is overwhelming, which leads to a high failure rate. And we all know what healthy foods are, and we all know the benefits of exercise, but let's hold off on those and work at one thing at a time. Fasting. People who start to incorporate fasting into their life very often don't change their diet at all, but still start to lose weight. They consume the exact quantity of calories they did before, but they are only eating them in their window. The reason again is because fat is an insulin imbalance, not a caloric one. What you eat isn't as important as when you eat it for fat loss. There is an excellent book on the subject called Delay, Don't Deny. And the thesis is you can have all the same foods you would normally have, just delay eating them until your feeding window. This is the very best and easiest place to start because then you don't have to feel like you're denying yourself or missing out on the foods that you love. Once you rebalance your body and get back down to your desired weight, you can work on improving your diet and exercising more. Both will be several magnitudes easier now that you have cured many food addictions, learned to listen to your body, and have lost a lot of weight, making formerly painful exercise now much easier and even enjoyable. I stopped feeling hungry at all. That seems dangerous. Do I have an eating disorder? When hunger disappears, that is your indicator it's working. This is normal as ghrelin goes down. For citations and more resources, check the links below.